Hello, I'm Muhammad Yousuf Ali, PhD scholar and associate librarian from Aga Khan University, Karachi, Pakistan. Greeting and welcome. Good morning, good afternoon, and good evening as per your time zone. I welcome you all in this online session of National Symposium. I am very thankful to the National Institute of Library and Information Science, University of Colombo, and collaborative partner, ASIS&T South Asian Chapter and Program Committee to giving me opportunity to share my research. Let's move to the PowerPoint slide.
Study topic: social media usage during the isolation of COVID-19 infected patient in Karachi, Pakistan, an overview. This is a collaborative work along with my co-authors, Dr. Salman bin Naim, Associate Professor, and Professor Dr. Robina Bhatti. Both are affiliated with the Islamia University, Bhavalpur, Punjab. A scheme of presentation: I discuss the introduction, COVID and social media, literature review, related literature, research methodology, data collection analysis results, and conclusion. Introduction: COVID first cases report on 8 December 2019 in Wuhan City, China. In Pakistan, first COVID-19 case report on the 26th February, Karachi. Human infected with the severe acute respiratory syndrome is known as a coronavirus, and which is referred as a COVID-19. Social media is one of the powerful tool to transmit the message in a shape of post, images, voice messages, video, and etc. A large number of social media platforms are available on the web, and millions of tweets, posts, messages, video, images are forwarded during the year 2020 in the phase of pandemic. Here is the statistics. You can see that the COVID status in Pakistan, and the data has been taken the Ministry of Health, Government of Pakistan. Literature review. In the year 2020 is dedicated the COVID-19. A bulk literature and informations are produced in all over the world. Few international local literature available related to COVID and social media discussed here. International literature: mental health and disorder risk factor in quarantine adults during the COVID-19 breakout in China, a cross-sectional study discussed by the Gao and others. Social media and anxiety effect on public and mental health disorder due to COVID-19 in Bangladesh were highlighted, Hussain and ETL. A cross-sectional survey done during the pandemic regarding the information and disinformation in Indian context study is conducted by Gupta and others. In local and Pakistani context, social media and fake news effects on the public health risk discussed by the Naeem and ETL. Social media experience has significant relationship, information and anxiety. Empirical study conducted by the Suraya and others in 2020. Public health awareness and information sources and channel mediums were described by the Ali and Bhatti in 2020. Detailed literature review you can see on the reference segment of this presentation. Objective of the study. This study has following objectives. Number one, to determine the social media usage during the quarantine period. Number two, to know the perception of respondent during the quarantine about the social media messages post. And number three, basis on the gender, which male or female are the most actively participates on the social media. Research questions and hypothesis. To conduct this research study, following research question and hypothesis and a hypothesis was developed. Number one, which social media platform respondents are used during the quarantine? Research question number two, what are the main purpose of the social media during the quarantine? And question number three, what are the perception of the user use social media during the quarantine? A hypothesis: there is no significant difference on gender-wise. Male and female respondent equally participate and use the social media during the quarantine. Methodology: research method, self-exploratory and descriptive study. This study is a salvage research design and population infected personnel of the COVID who is spent quarantine period of 7 to 14 days. Sample techniques. Snowball sample techniques is used to conduct this study. Data collection and analysis. Data was collected through online survey and questionnaire is the research tool. Online questionnaire flowed from 16 to 31st August December 2020. Sample and descriptive studies are present and an inferential t-test is used. Slide number 12 to 17, we have showing the statistical results. I have just run these slides, slide number 12 for the demographical information, slide number 13 for the social media platform used by the respondent, slide number 14 for the social media video-based platform used by the respondent during the quarantine, slide number 14 for the purpose of use of social media during the quarantine, slide number 15 purpose use of social media during the quarantine, slide number 16 purpose of perception of respondent when they use the social media during the quarantine, and slide number 17 about the hypothesis result. Conclusion. The result of these studies are shows that a quarantine or isolation period, COVID patients are used social media to connect with their family and friends. COVID-related negative and fake news messages make negative impact and increase their mental and anxiety and stress. Respondents also report they use social media to read the public health awareness messages related to the COVID and disseminate it accordingly. Quarantine period respondents are rely on the authentic source of information like Government of Pakistan, Health Portal, World Health Organization, WHO, and UNESCO, and other reliable source. Last but not least, respondent request, please share only authentic and reliable information for social media platforms. Here is the references or literature used for this study. Thanks for watching till the end, and you can connect with me if you have any query about this study. Thank you so much.